In the wake of disturbing and violent incidents in Toronto, the city is looking to hospitals to help cure crime. Hospital-based intervention programs are helping victims of violence beyond just treating their wounds. Similar programs in other cities have been known to cut gun violence by half. But now the city needs provincial funding in order to expand the programs and keep them operational.
It used to be that we would treat the patient's physical injuries and then they'd be discharged from hospital and the relationship would stop at that end.
But that relationship now extends long after the patient has been discharged. Sunnybrook Hospital is the first in Toronto to treat more than just the physical trauma of shootings and stabbings, but also attempts to address the root issues that may have led to the violence in the first place.
These types of interventions, they're relevant and they can have an impact.
The BRAVE program was born in 2020 in response to a steady increase in violence and the result of Toronto Board of Health deeming community violence a public health issue. Case managers work with gunshot and stabbing victims under the age of 30 for up to a year.
So if it's returning to school, if it's finding suitable employment, if it's finding suitable housing, then we will work with that patient to address those underlying factors.
We're seeing that we have a real tangible impact on these individuals' lives.
We're told 2/3 of patients approached participate in the program. In its first year, case managers helped 42 gunshot victims and 27 stabbing victims. They also paid 300 home visits to keep patients on track and saw a 37% reduction in risk factors during the program enrollment.
Based on the successes from our early days, we were able to get, with gratitude to the city, further supports for expansion.
The city has committed an additional $250,000 to sustain and expand the program. St. Michael's Hospital launched its Thrive program late last year, but more funding is urgently needed.
This is one of those important opportunities. But healthcare is not the purview of the City of Toronto, and we need the province to step in and to work with these hospitals to actually fund in an ongoing basis this type of intervention.
In New York, a hospital intervention program at Jacobi Medical Center in the Bronx is breaking the cycle of violence. Since its inception 9 years ago, the incidence of gunshot wounds have decreased by 57% in the surrounding community.
Essentially, it's using the hospital as the epidemiologic center of where the violence is presenting, and then using that to further allocate resources outward the community to prevent more patients from coming in.
This is the new drip. This is what it's about.
If you're able to just change one person's life little by little, I think you start changing community norms, you start changing hospital norms, and hopefully start saving more lives.
We asked the province if they plan on funding the programs, but the Ministry of Health didn't get back to us before airtime. For City News, I'm Tina Yazdani.